All right, how long have you had lower back pain for?
On and off for the last probably like on and off for the last 5 years.
Okay. Was there an accident or injury at the beginning of that?
Yeah, I got in a car accident.
Okay. Was there any treatment after the car accident?
There was some treatment, some physical therapy, but nothing really got resolved.
Okay. All right, are your symptoms better or worse than they were 5 years ago?
Worse.
Okay. What are the symptoms now?
Biggest thing is constant pressure in my lower back, almost close to my sciatic, and then between my calf and my ankle.
Okay. All right, have you had any imaging done, any x-rays or MRIs?
So I had x-rays done a week and a half ago.
Okay.
So they can't really tell serious soft tissue damage with that. It was really just they found that I had spina bifida.
Do you remember where you had the spina bifida?
It's my S1, because my whole right side will like seize up.
Yeah.
If I start pulling my leg backwards,
like an extension like this?
Pulling it back.
Okay.
It'll get like stuck.
Okay.
And start spasming.
All right, so do you get numbness and tingling? You have pain and pressure in that calf, but does it ever get numb or tingle in your feet?
In my toes, yeah.
Okay.
Yeah, pretty much from my ankle down, but mostly almost complete and consistent numbness in my toes.
Consistent throughout the day? Like you get numbness throughout most of the day?
Yes.
Okay.
Sometimes the pain will radiate from the back of my neck down my spine, and sometimes that's when I can tell when I'm going to be kind of locked up or my leg will start spasming to the point where I'll be curled up in a ball, like holding my leg trying to, because my toes will get stuck. I'll have like 2 toes going left, 2 toes like kind of curled going right, and I can't move them, so I'm literally trying to get them to move because I can't stand.
Okay.
I can't walk. I'll just.
How often does that happen?
At least several times a week.
Okay.
Like last week, it was almost every day. Yeah, sometimes there's just no relief. It's just crippling pain.
We're definitely in MRI range, that's for sure. It sounds like some of this is coming from a pinched nerve. So the next thing to look at that and to determine the severity of it would be to get an MRI. But let's go over some other things. Do you ever have any neck pain, headaches?
I get migraines.
How often do you get migraines?
So now I might get 2 a month.
Okay.
It got really bad last year where I was in the hospital. And I had to see a neurologist. So I get ocular and venous migraines. So I lose my vision and then I lose feeling in my arms and my hands.
How often do you have that?
The vision part isn't as much right now. They upped my magnesium intake and then my riboflavin. So I don't get those as much, but usually typical migraine where I can't get out of bed, can't see sunlight at least twice a month.
Okay. Are they cycle related at all?
They'll just kind of come up sporadically.
Okay. How long have you been getting those for?
I've been getting migraines 7, so.
What age did they start at?
8.
Okay. All right, you had a head injury?
I've had 6 concussions.
Okay. So what age were you in the hospital?
26. To check when I was losing my vision last year, I was 26.
Okay. What was the head injury previous to that?
Most of them were from soccer.
Okay. All right, so some sports injuries, concussions, all of that, but you've had the migraines since you were a kid. So concussions may have influenced it in a way to make it worse, but not necessarily the cause. All right, so let's do this. Let's start off with an exam. Let's see what your spine says, and then I'll get you adjusted today. And then after that, I'll give you some, whatever I think that you could possibly be doing on your own to help you, because obviously you're 5 hours away. And so it's really what's gonna make the most difference is what you do from this day. Okay, looking at the feet first, heel strike, mid stance, and toe off are normal on the right, but on toe off on the left, there's an eversion a slight rotation externally. Come back this way. And then coming up to the shoulders, we have a high left shoulder. Definitely a high left shoulder, but the arm swing looks even from left to right, and so I don't see any potential curvatures in the thoracic spine. That's good. Coming back this way. And with the high left shoulder, it looks like we have a head tilt to the left in that same direction as compensation. Okay, that's good. Okay, looking at the hip swing, it looks symmetrical from here, maybe a slight accentuation to the left. It's down the right leg, right? The symptoms are in your right leg?
Yeah, so when I walk, like I can actually feel it in here.
Okay. So it sounds like we have some nerve impingement causing that pressure down in the calf. And the back of the calf really should be the L5-S1 nerve root. Go back again, which is where, and the spina bifida is at S1. Okay, I'm going to do a very gentle scan on the top of your spine. Okay, lots of tension I'm picking up here in the upper left shoulder blade. The musculature is more prominent here on the left than on the right. Now, let's see what happens. I'm going to do a temperature examination. The temperature is pretty consistent. You're a little warmer up here in your shoulder blades. It drops off just a little bit here in the lumbosacral spine. But then the moisture really picks up. Like you're nice and smooth and dry here. And then as soon as we get down to this, you don't have the tuft of hair here. So no, there's nothing there. If I had to say, the most likely the S1 spina bifida is most likely not contributing in this case. We're going to need the MRI to make sure and to verify that, but I'm going to push in a little bit deeper, okay? All right. Okay, I'm going to put my fingertips on top of your hips so I can measure where we're at here. All right, so, yeah, we're at the lower lumbar, L3, L4. There's definitely some edema and some swelling over top of this spinous process. I'm going to push in a little bit here. Pain?
Yeah.
Pain?
Mm-hmm.
Which one more? First one or the second one? Right or left? We're same. Here's the SI. Tender?
Mm-hmm. Yep.
Here's the SI. Tender?
Definitely more on the right.
Okay, we have some right SI tenderness. And this is at the level of S2 right here. So still S1. The spina bifida really is right here. Tender?
Mm-hmm.
Okay. How about S2? Is that tender?
Yeah.
Okay. One was more though, right?
Yeah.
This is L5. Okay, so more tension on the right side in the lumbar. The musculature is is evenly tense. So we don't have any prominence here. And the SI joint on the right is tender. All right, let's see how they're moving. Let's do this. Bring your feet together. I'm going to lower this down so I can see your SI joints. All right, what you're going to do is keeping your feet flat on the ground. Move your knees together. Okay, now apart. Go together. Apart. Go together. Apart. Go together. Apart. Okay, so almost no movement on the left SI joint here. It's very restricted on this side. Is this tender?
A little bit. Not as much as that side.
Okay. So this could be possibly the hypermobile side. This is the side of the symptoms. This is where the nerve is being pinched on the right side, whether it's coming from L5 or S1, and which segment we have to adjust is the most important. Okay, do just the left.
Like just bring
Yeah,
it out.
just yes. Center. Left. Center. Okay, now do just the right. Yeah. Right, the right is moving normally, so I don't think this is hypermobile. But I think we do have a restriction on the left. Nerve pinching on the right. Okay, we have to determine which way that this is stuck. Okay, so let's do this. We're gonna lean to the left like this. Gonna come back. Now lean to the right. Good movement, leaning to the left, or leaning to the right. This movement, left, no movement. Okay, let's do this, go forward. Pain?
Just in where that's more difficult.
Back is more difficult?
Yeah, back is more like pain up my spine and down my right leg.
This goes down your leg.
Yeah.
Okay.
Should I feel lightheaded?
Need some water? Okay, hold on.
Thank you.
Yep, I'm pushing on things, making things hurt. Things that typically you're avoiding putting pressure on. You're just aggravating it, directly aggravating it. So, a nice little combination SI joint lumbar. So we're most likely going to adjust the lumbar on the left and the SI joint on the right. But we're going to have to do a couple more things to find out. All right, I'm going to look at your glute folds now, okay? All right, so looking from the bottom, we're going to trace this up to the top of the bottom of the glute fold. We're lower on the right, which means the right hip is possibly gone back where the left hip is going forward. We'll see that standing. Then looking from the top, they look basically even, so I don't find any external. Actually, make your toes even. Good, that's good. All right, so the right side does come out, which means the external rotation will be on the right, and then an internal rotation of the hip on the left. Okay, not too much forward and backward instability there, but definitely have some lateral instability. We have some nerve pinching, so that is always a category 3, but I can see where the category 2 is coming into play, that you will have some hypermobility when we look down at your SI joints. Okay, you still feel pressure in the spine right now?
Mm-hmm. Yes.
Do you feel it in your calf right now?
Yes. Not as intense as the spine.
Okay, I'm going to bend your knees. We'll see if this increases the pain in your back and your hips. Any increase there?
Just my hip.
Okay, right leg was short. That matches what we saw on the glutes fiber test, the standing test. And then the right short, and it stays short when I bend, which tells us that the left SI joint is the primary target, left SI joint. So, give your hip. Good, just try to relax. Let me do the lifting. Good. Do the left hip. Good. Still feel the pressure?
I feel like not as much.
A little tender.
Mm-hmm.
And so this has a global effect when we work on the trapezius muscle here, especially when you're on the blocks. Right now I'm trying to balance the tension in your spinal cord. So the cord that's dangling down in your spinal canal, and where it's pinching, most likely it's pinching in where the nerve exits the spine. So if we can decrease the tension in the spine mechanically, we might be able to get some slack down there and a little bit more room for that nerve. Take pressure off and get rid of that pain that's going down your leg. Okay, lots of different exams are pointing in different directions. The most important one was that when you were sitting and I had my hands on your spine and you couldn't lean to the left as much, that means you have an open wedge here on the left. It's most likely in this L5, S1, the very last disc in your spine. That's going to be our primary. Our primary is here at L5, S1, the very bottom disc. We're going to have to close that disc up. That's where the issue is. That's where this pinching is coming from. That's what we need to unpinch today. Do you feel the pain in your calf right now?
Not as much.
Okay. What about in here, in your hip?
It's definitely less.
So we're just going to take some nice soft breaths. And we're just going to sink into this sound. gentle breathing. All right, I'm gonna do one more check. This is a check in your cervical spine, but it actually tells me what's happening in your lumbar spine because these muscles are continuous. They go all the way down through the spine. All right, so this feels a little bit more tender on the left. You tell me that. Tender on the left or tender on the right?
More tender on the left.
Okay. So that tender transverse process right here lets me know that it's your left L5 transverse process that's moved posterior. So we're going to push in this direction on the L5. So that means your L5 with the open wedge, we would give this the category listing of a PRI on the right because the spine is moved posterior to the right and then inferior. Okay, we're going to start right in the middle. Nice and gentle. Tender in there? Okay, so let's practice one first, Dee, just so you can kind of feel what it's like. You're going to take a deep breath in and out. And I'm going to follow let your shoulders sink in. Go let it go a little bit more. We'll get some tension here. I'm going to follow your breath out. You got any more relax in there? Okay. I'm going to follow your breath out, and I'm going to do a little push, okay? We're going to start off extremely gentle, okay?
Okay.
We're not going to push hard. All you have to do is breathe. So let's do that again. Take a deep breath in and out. Good. Shoulders sinking. Good. Let it all go.
Oh!
Breathe. Breathe through your nose. Breathe through your nose.
I think I'm just like, I've just been so tense for so long.
Yeah, that's exactly what's happening.
Okay.
You've been in pain. When you're in pain, your muscles don't relax. Your muscles are all tense, trying to keep you and avoid that, whatever position it is that irritates the structures that are injured. And so you've had all this muscle compensation over time. It's hard to let go in a moment, but that's why we've taken our time up to this point. That was good, though. We got some motion. Okay, your back is able to be adjusted. That's good. You hit your head on the microphone on the way up. Is that all right?
Yeah, I'm fine.
Okay, you ready for try another one?
Mm-hmm.
You're doing great. We're gonna give this a little push. Okay, you're nice and relaxed this time, dude. That's good. Following your breath. Gentle, 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 gentle. Good. Soft breath. Good. Shoulders, shoulders sinking. Okay, nice and gentle breathing. I'm gonna stretch your shoulders up in this direction like this. I'm gonna bring your hips down, and then we push like that, okay? Okay, you're breathing. Go and take a deep breath in through your nose. Good, I'm gonna follow your breath out like this. Good, letting it go. We're gonna follow the breath out, bring the hip down. Good, little push here, good, good. Okay, let's do this. Let's stand up. Good. So you're gonna stand up.
I definitely don't feel as much. I don't feel the pressure in here. Like it went from feeling like consistent pressure, like you still had your finger there, to nothing.
Okay. All right, good start. That was a great adjustment. All right, so we're gonna bend this leg, but just minimally. I'm gonna bring it forward here just a little bit first. We don't want to bend this leg too much. Is that okay right there? Okay. All right, so we're gonna bring your shoulders in this direction, your hip down, following the breath, and we're gonna adjust the SI joint on this side, okay? Let's try that. Deep breath in and out. Good, let the shoulders come up. Good, just gentle here, gentle. Good. Bend your back.
I actually have feeling in my toes.
That's good.
That's,
That's a big deal.
yeah.
Right is still short, that's consistent. This is how we check the neck. So go ahead and turn your head to the right. Good, back to center. Now to the left. Back to center. That evened you out, so we have a right upper cervical. Now bring your left ear down to your shoulder. That evened it out too. Okay, back to center. Are you ready to get your neck rocked?
Mm-hmm.
Okay, nice and gentle. We're gonna do the right side first. Atlas on the top, C1. Good, I'm gonna bring your head over to the side like this. Nice and gentle, just like the other adjustments. I'm gonna follow your breath. We're gonna push like that, okay? Okay, gentle. Good, head dropping in. Good. Very gentle little push here. Let your head and shoulders drop in. Good, nice soft breath in through your nose. And out through your nose. Good, sinking. Same thing on the left. Nice and gentle. I'm going to bring your head over to the side like this. Okay, let your head relax. We're going to test first. 7, 6, 5, 4, 3, 2. Good, it's very upper cervical. Lots of C2 here. We're going to adjust C2 on the left. Gentle, gentle, gentle. Let your head completely relax into the table. Good. Good. Sensitive?
What?
Sensitive?
Yeah, a little bit.
Oh man.
Ever since I started having to take the thyroid hormone, it's my body heat is off.
Okay. We'll get there. Good. We have this little pull here. Good. And then one on this right side here. Good. Let that relax here. Good. Right, so first we're going to do a diaphragm release, okay? So the diaphragm is right here underneath the rib cage. We're just going to follow your breath. Can you do any deep belly breathing? Good. Try to breathe into your belly. Do you know how to belly breathe? When you breathe in, push your belly out.
Okay.
Good. Breathe in, push your belly out. Good. Now when you breathe out, suck your belly in towards your spine. Good. Breathe in, belly out. Breathe out, belly in. Good movement there. Again, in and out. Good. Keep going into your belly. Good, into your belly. Okay, this is a digestive organ manipulation. We do the ileocecal valve first by finding the umbilical here and the ASIS, the hip. Connect those 2 points so we start to look. Yours is definitely full and tense right now. Is that tender to you? Mm-hmm. Good. Pyloric sphincter. This is where the stomach empties into the duodenum. Good, yours is open right now. That's fine. A little tender?
Mm-hmm.
Good. Deep belly breath. This is a decompression adjustment. Your hips are held in place by the pins. I'm going to use this towel. You okay with that? I do that? Okay, we're going to use this towel to support your neck like this. And then as you breathe out, I'm going to follow your breath. We're going to use the towel, and then we're going to pull like this in that direction, okay? Okay. Feel any pain, pressure when I do that?
Just some pressure in my neck.
Okay, that's fine. All right, good. We're probably going to see some neck releases here too. All right, so let's try that. Let's try that out. Go ahead and take a deep breath in. Good. As you breathe out. Good. We're going to follow this down. Good. Feel it in your lower back?
Yep.
L4 reflexes are okay, but it's your L5 disc, so that really is inconsequential at this point. How do you feel?
Well, there's not the pain or like pressure in my leg, which feels kind of weird because I think I'm just so used to it at this point. So it's it not being there feels kind of abnormal. But yeah, I don't feel the constant pressure, which is nuts.
Good. Shoulders sinking.
Biggest thing is constant pressure in my lower back, and then between my calf and my ankle. Almost complete and consistent numbness in my toes.
Good.
I actually have feeling in my toes.
Good. Sinking. Good. Good.
Well, there's not the pain or like pressure in my leg. Yeah, I don't feel the constant pressure, which is nuts. Yeah, sometimes there's just no relief. It's
Okay.
just crippling pain. I don't feel the pressure in here. Like it went from feeling like consistent pressure, like you still had your finger there, to nothing.